Good morning, my dear undergraduate students. Welcome to R.A.T.S in Pathology. The meaning is Racing Against Time for Students in Pathology. All of us know this, but can you answer this question? After R.A.T.S, NEET or next? Please register this in a corner of your mind and we shall meet soon. In today's class, I present with a case history. A 6-year-old boy received his DPT vaccine, which means diphtheria, pertussis, and tetanus. Hours later, he developed redness over his thigh. His vital signs were normal, but his leukocyte count was slightly elevated. What is your diagnosis? Yes, it is a type 3 hypersensitivity reaction. We shall be seeing the causes and the pathogenesis of this condition. The pioneer behind this is R.A.T.S. That is why many books call it as an R.A.T.S phenomenon. Nicholas Morris R.A.T.S, a physiologist and a physician. Repeatedly, I am taking you people to tips which gives an outline of all these questions. Now, what are the factors precipitating type 3 hypersensitivity reaction? You find that there is a persistent and recurrent infection. This leads to antigen-antibody complexes. Sometimes there can be a complement deficiency or there can be genetic defects in phagocytosis. All of this can precipitate a type 3 hypersensitivity reaction. Recurrent infection, antigen-antibody complexes, complement deficiency, defects in phagocytosis. It is commonly seen in some autoimmune disorders such as rheumatoid arthritis and SLE. There is a deposition of the immune complex which precipitates inflammation. This we shall be seeing in the subsequent diagrams. This is a very important picture which I would like you people to kindly follow with me. So in this case, there is an antigen. Antigen is, we have seen already, a substance that is being introduced into the body. It can be a protein, it can be a bacteria, whatever be it. It can be exogenous or endogenous. And once it is introduced, it enters the circulation. So there is a circulation of the antigens. This stimulates the B lymphocytes. The B lymphocyte in turn mature into the plasma cell. All of us know that the plasma cells produce the specific antibody against each of the antigens. So what we are seeing here is a plasma cell which is producing the antibodies, Y-shaped structures. And this triangle and the Y together form a complex. Antigen and antibody together form a complex which is called an immune complex or an antigen-antibody complex, whatever be it. And see, they are again continuing in the circulation. This is a diagrammatic cross-section of a small blood vessel in which I find that this antigen-antibody complex is being deposited, the blue colored ones, and it stimulates the complement in turn. It stimulates the complement, as a result of which there will be an immune complex mediated reaction or inflammation. So this will lead to release of some substances which causes reaction. So this is the basic pathology. I would like you people to kindly switch off or stop, revert, and again examine this. I repeat it once again. Circulating immune complexes in the blood vessels which are being carried. They are being activated by means of the complement system. Now, when the complex is very large, it is removed by the phagocytic cells. So no harm occurs. And when it is very small, it passes through the capillaries or the interendothelial gaps and causes no damage. Large complex, no damage. Small complex, no damage. But when the complex is medium sized, it gets trapped and it precipitates the reaction. This one we people should be having in mind. The same philosophy we shall be applying in glomerulonephritis also. So this is the pathogenesis. Please do remember, I shall be repeating it any number of times. Look at this once again. So there is an antigen and antibody. It precipitates the platelets. There is a microthrombi, which can lead to ischemia and necrosis. This is one part of the story. But the main part is it precipitates the complement C3A, C5A, which are anaphylatoxins released by the basophil, and histamine leading to vasodilation, and there is an edema and probably even necrosis. Also, on the other hand, there can be chemotaxis, neutrophil activation, lysosomal enzymes are being released, damage to the tissues, vasculitis, necrosis. This is what is happening. Almost the same story we had seen in type 1 hypersensitivity, where histamine is being released, vasodilatation, etc. But here it is localized. That is why Robin says R.A.T.S phenomenon can be considered as a localized form of an anaphylaxis. So these are the important keywords that you people shall memorize and remember. What are the anaphylatoxins? What are the opsonins? What is the membrane attack complex? What is the mast cell degranulation? Histamine deposition, lytic enzymes, and damage to the tissues. This you people shall be remembering. A wonderful couple of squares which is of paramount importance. The same thing is being described diagrammatically. Labpedia, a wonderful source, a dedicated service that he has been rendering. So there is an activation of the complement, phagocytosis, membrane attack complex, etc., leading to lysis and necrosis. Also, there is a release of the anaphylatoxin from the mast cells and the basophils. Histamine will be causing vascular permeability, all of which can lead to an edema. Later on, there can be microthrombi also, ischemia leading to necrosis. So there is the release of the kinins leading to vasodilation, and there is edema that is to be seen. That is why you are finding all the reactions shown in the pictures. The type 3 hypersensitivity is divided into two types. One is localized, the other is generalized. The localized is otherwise called the R.A.T.S phenomenon, after the sir whose picture we saw earlier. An antigen is injected, it leads to localized immune complexes. After 4 to 8 hours, there is a vessel damage, edema, and even necrosis. This is an R.A.T.S reaction or a phenomenon. This can be a question by itself. Generalized can be serum sickness, a classical example, wherein the complexes are being circulating. Normally, it is only the antigen, but here the immune complexes are circulating and they are trapped at the sites of filtration, such as the glomerulus or the small blood vessels or the joints, as a result of which you get these lesions. So, localized type 3 hypersensitivity, generalized type 3 hypersensitivity. This is again a fantastic picture, a repetition of the same. See what is happening. So, These are the antigens, the Y shapes are the antibodies. You find that a complex is formed, the complex is being deposited in the vessel wall. And this is the intact endothelium that we are seeing. This will be precipitating the complement activity, as a result of which you find a lot of enzymes can be released from the lysosomal sacs, etc., which lead to damage to the endothelium, leakage of material, and the various types of necrosis, edema, etc. Please do remember these two. This is a good diagram for you people to draw. And as a summary, this is again from Labpedia. You people can see. There is a complex over here and it is getting deposited. There is activation of the other cells such as the neutrophils and the basophils. There is a degranulation, activation of the complements, and then there is a release of the vasoactive amines, 5-hydroxytryptophan or the histamines, which will lead to permeability, retraction of the endothelial cells, and all the reactions such as an inflammatory process, so on. So this particular one, you people shall summarize. I myself have told you this at least a half a dozen times. So you people will remember and reproduce type 3 hypersensitivity, localized and generalized, R.A.T.S phenomenon, and all of this can be questions for you. The quote of the day: everything comes in time to those who can wait. Francois Rabelais. So there is a message for us. I start the next topic with a case history. A 12-year-old boy was brought to the outpatient unit with complaints of loss of weight and appetite. He was said to have a mild evening rise of temperature. So this is a complaint. After examination, the physician asked for a test to be done and report to the OP again after 2 days. And this was the finding. So this is the finding over here. I would like you people to kindly come to a diagnosis. I shall be explaining this picture, and the diagnosis is the test that has been done is a tuberculin skin test or a Mantoux test. It is for a delayed type of hypersensitivity found in certain disorders, particularly tuberculosis. It is the injection of a purified protein derivative intradermally after a period of 48 to 72 hours. That is why the patient was asked to come after 72 hours. There is an area of redness. This is called erythema. This should not be measured. But instead, if you run your finger over the lesion, you will be finding a firm, elevated nodule, which is called induration. This must be measured. It is negative if it is less than 5 millimeters, intermediate 5 to 9 millimeters, and positive if it is more than 9 millimeters. So in this case, it is 1 to 1.5 millimeters. We can take it as positive. And this is a prototype of type 4 hypersensitivity. This itself is a university question for us. What is the definition? It is a T cell mediated type of hypersensitivity caused by inflammation resulting from the release of cytokines. They are produced by the CD4 plus type of T cells. Plus means positive T cells. The cytotoxicity or the killing of the cells is caused by CD8 cells. CD4 cells help, whereas the CD8 cells are cytotoxic cells. Cytokines that we have mentioned here, they induce inflammation, which is chronic. At the same time, it is destructive. We shall see what is the outcome of this destruction. And it is a delayed type of hypersensitivity occurring after 48 to 72 hours. That is why that particular patient was asked to come after 2 days. So I shall be explaining the pathogenesis of the type 4 hypersensitivity. There are two stages of it. One is called the sensitization phase, in which the bacteria or the protein is being introduced and it is taken up by the cell. So this is an antigen presenting cell that presents it to the rest of the body, the macrophages. This activates the T helper cells that we are seeing over here. And these T helper cells produce some substances, which in turn will lead to the activation of the receptors. That is what is happening over here. And they are called the delayed type of hypersensitivity cells. DTH means delayed type of hypersensitivity cells. Courtesy will be to these people, and this is the reference. After the sensitization phase, there is an effector phase. So in this case again, there is the receptor over here, and subsequently you find that the same antigen is being introduced. The macrophage, which is at a resting stage, is being activated. When the macrophage is activated, a lot of these receptors are being produced and it is capable of producing a lot of substances. Look at these products. I would like you people to kindly memorize these two rectangles. There can be the production of interferon and tumor necrosis factor beta. Interferon, tumor necrosis factor beta. Interleukin 2 and 3 and 8. So these will be causing a kind of inflammatory reaction. At the same time, the macrophages will be activating the MHC and the tumor necrosis factor receptor, as a result of which there will be the release of the free radicals, and this includes nitric oxide as well. So look at the plethora of mediators that can be released by this particular reaction. That is why we get the various changes as shown in the picture earlier. The hallmark of a tuberculin reaction is erythema, induration. Induration is a classical hallmark or a definitive diagnosis after 48 to 72 hours. Erythema alone is not adequate. And microscopically, I will be seeing a perivascular cuffing with lymphocytes. These lymphocytes are later on replaced by, or they are chemotactic for macrophages, which together form the granuloma. The classical examples are the tuberculin test or the Mantoux test, lepromin test, brucellosis test. So these three we shall be memorizing. These are all classical examples of type 4 hypersensitivity. So this is a Mantoux test being done. So you find that the antigen is being injected intradermally, purified protein derivative, after which you find that there is an area of erythema and then induration. The induration alone is measured. So this is again the same thing. There is an antigen presenting cell. So, and it activates the lymphocytes. The lymphocyte becomes sensitized, and there is in turn a chemotaxis for the macrophages. The macrophages become activated, and finally a granuloma is formed. This particular flow diagram I would like you people to draw in your exam, because it is very simple, easy to reproduce and draw. This is the story of the erythema and induration. Now, the Mantoux test or the tuberculin test can be positive in a case of tuberculosis, leprosy, brucellosis. These are certain things. However, you find that there are some cases where the tuberculin test can be negative, but the patient may still be having tuberculosis. HIV infection, where there is a generalized immunosuppression, severe malnutrition, other bacterial infections can be there. viral infections, when the patient is on steroids, all this can be there. We call it as atopy or non-active reaction. So this should be borne in mind when we are giving a Mantoux test. This is a hallmark of the reaction. And this is an age-old story you people know. There is a central area of necrosis. That is why it has been described as destruction of the cells. And these are the bacilli which persist. Surrounding it, you find that there will be the macrophages. Macrophages, but later on they become modified into epithelioid cells, resembling the epithelial cells. And there is a cup of lymphocytes. In order that the lesion be restricted, there will be a rim of fibroblasts that is surrounding the lesion. So this is what is happening over here. I would like you people to revise it. You have seen it n number of times. This is again a very beautiful diagram, simple diagram, which you people can draw. As I come to the end of the class, I apologize that a very handsome face is being camouflaged by me. Excellence is not being the best. It is doing your best. What am I trying to say? After R.A.T.S, NEET or next. Thank you.